If everyone's ready, let's resume with our next speaker. Good afternoon. Thank you.
Chairman and distinguished members of the panel. My name is Stephen Teitelbaum. I'm a board-certified plastic surgeon from Santa Monica, California. I do not have any financial relationship with any implant manufacturer, and I paid for my own travel. You have all been charged with a quite daunting task. Daunting? You've only have to decide whether the risks of silicone implants and the benefits weigh out favorably. That sounds easy enough. In fact, the FDA has approved implants and devices far more hazardous than anyone has ever thought that silicone breast implants could possibly be. Something here is clearly different. Why is there so much testimony? Why is this room so full? This is it. It's that the risks and benefits of this device are described in very different languages. And because the languages are different, we cannot make a direct comparison. The risks are described in quantifiable, scientific terms, but the benefits are described in vague, sociological terms. How can anyone offset the risk of an infection against improved self-esteem? You can't. You can't for anybody except for yourself. Studies show silicone implants improve self-esteem, but they cannot tell you how much weight to give to self-esteem. Some would argue improving self-esteem by surgery is of no value. Others would say that self-image is important to an individual's sense of well-being as any truly medical issue. Putting a value on self-esteem requires a moral judgment, which I believe is inconsistent with your task here, because you should be scientific and apolitical. An objective conclusion about this device, therefore, is impractical. Since this surgery is elective, some suggest that you need to demand more for this device than you might for a medically necessary device. I see it the other way. With a medically necessary device, someone finds themselves sick or in pain, and they have no way to evaluate the device and due diligence it. They need you to do that for them. But breast augmentation patients, they seek out these implants. They think about it over many years, absorbing sources of data from many places. They can due diligence this for themselves. And this leads to the solution. Since 250,000 women choose breast augmentation, I believe you should accept as axiomatic that this is important, very important, and of value to some people. Do we know the risks well enough to adequately inform women? The answer is an unequivocal yes. Questions remain. There are unknowns. We never know everything about anything. Just demand that the patients are told where the data ends and where the unknown is. As long as patients know what they know and what they don't know, they can make an informed choice. Arguing that the data is insufficient to allow a thoughtful choice requires assumptions that the benefits do not outweigh those unknown risks. You have therefore used your own value system to unconsciously assign a low value to the benefits. For some women, the benefits will not outweigh the unknown risks, but for others, it will. That is their decision. Female plastic surgeons prefer them predominantly when looking for themselves or loved ones. This proves that the severity and rate of complications is so low and so subtle that it does not rise to the level where the panel needs to protect Americans from this option. It is often implied that the testimony of a plastic surgeon is biased by financial considerations. Actually, it is of no consequence at all to me whether I use saline or silicone, but it is a consequence to my patients, and that is why I'm here. I was moved by today's testimonies, but if you spent an hour in the lobby of any medical office building, you would hear similar stories from women who do not have implants.
If you could wrap it up, please.
I do not doubt the sincerity of these women. They are looking and think they have found an explanation for why they have developed the disease, but their belief is based upon faith, and this panel should render decision only based upon science. Thank you.